Public Health England has just launched the latest edition of Health Matters, which focuses on obesity and the food environment. Obesity can lead to serious diseases such as type 2 diabetes and heart disease. It can affect self-esteem and underlying mental health and affect a person's quality of life and life chances. In 2015, 2/3 of adults in England were classed as being overweight or obese, with 1 in 4 adults classed as obese. And 1/3 of 10 to 11-year-olds and over 1/5 of 4 to 5-year-olds were either overweight or obese. At current rates, it's projected that 60% of adult men and half of adult women will be obese by 2050, along with 1/4 of all our children. It is estimated that the NHS in England spent £6.1 billion in overweight and obesity-related ill health in 2014-15. Failing to address the challenge posed by the obesity epidemic will place an even greater burden on local councils and NHS resources in the future. Now, the reality is that no one is immune to obesity, but some people are more likely to become overweight or obese than others. Income, social deprivation, and ethnicity all have an impact on the likelihood of becoming obese. Obesity prevalence in the most deprived 10% of the population is approximately twice that in the least deprived 10%. Behavior, environment, genetics, and culture all play a part in the rise of obesity. The evidence base for eating a healthy diet is compelling, but we still find it difficult to eat healthily. And this is primarily because we're living in an obesogenic environment that encourages weight gain and obesity. The increasing consumption of out-of-home meals has been identified as one of the key factors contributing to rising levels of obesity. For instance, 1/5 of children eat food from out-of-home outlets at least once per week, and the highest density of takeaways is in areas of highest deprivation. This edition of Health Matters focuses specifically on what can be done to improve the food environment so that healthier options are accessible, available, and affordable. Now, this can only be accomplished through a collaborative approach with effective partnerships and coordinated action at a local level across public, private, and voluntary sectors, with councils taking this forward through their leadership. Please take a look at the Health Matters online resource. It includes recommendations and supporting materials, including downloadable infographics and slides that you can use in presentations and discussions with colleagues, as well as case studies and videos. Thank you for watching.